Welcome to Lao Friends Hospital for Children. One of my favorite parts of my job is getting to show all the new volunteers around and show them why our hospital is so special. Lao Friends Hospital for Children is on the campus of the Luang Prabang Provincial Hospital. And when this hospital was established, it was with a 10-year agreement with the provincial hospital that Friends Without a Border would administer and fund the hospital essentially for the first 10 years. I hope to be able to share with you guys a little bit about what the volunteer experience at Lao Friends Hospital is like.
How do you feel like the last 3 months have gone, the whole volunteer experience?
Well, I would say overall everything was actually very different than what I expected.
Yeah.
I had no idea that, first of all, that there was so much teamwork and how involved on every level, like physicians, doctors, nurses,
Like
outreach.
multidisciplinary thing.
Exactly. I mean, it was very, very strong.
So I've been at Lao Friends Hospital for Children in Luang Prabang for about 5 weeks now, and the experience so far has been excellent. Is not even enough of a word to describe it. First of all, the patients and their families, just seeing their resiliency and seeing how they deal with all of these illnesses, and having these new doctors come in and see them and be involved in their child's care. It's been very humbling to be a part of that. The team here is excellent. It's a really huge team effort that comes together to make this hospital the way it is.
What I have really loved about working here is watching how the doctors and nurses work in a very non-hierarchical way. Everyone works in a collegial way. So doctors do tasks that often nurses would do tasks that sometimes doctors will do, and the communication seems to be very easy. The other thing that I've also really enjoyed is that there is a playfulness about the way that things are done here. So not to say that they don't take their job seriously, but there is like a lightness to the way that patients are interacted with and the treatment, and that is something that I didn't expect.
I've enjoyed that interaction with the local Lao doctors, seeing some conditions I only learned about at medical school for the first time, not just once or twice, but every day or every week, things like thalassemia, typhoid and beriberi, and conditions we don't often see in Australia.
The other issue is the malnutrition, which I'm seeing a lot of, and a very, very strange condition called beriberi, which is a thiamine deficiency. And these babies normally in the first 3 months of life, if the mother is not having enough thiamine in her diet, the baby doesn't get thiamine, and these babies come into hospital, they get given thiamine, and 1 hour later it's like you're looking at a different baby. And I have never seen this before. This is like unbelievable.
And otherwise, lots of orthopedic injuries, other traumas, severe burns we'll see in here, a lot of bad respiratory illnesses.
Obviously, dealing with illnesses that we don't have a treatment for is always the hardest. It's hard for us as physicians and healthcare providers, but it's also hard for the family to know that there's not much else that we can provide for them. That's definitely a hard part about working here as well, is that we know that in other parts of the world we may have more that we can give these families, but we do have to be happy about what we are able to offer. And so I think it's finding that balance between knowing that we are making a difference, but also in our hearts that sometimes there is a limit to what we can offer.
The typhoid and the malaria, and of course the beriberi being just the nutritional deficiency. Had no idea about the extent of it, and I learned volumes about how to care for those patients. And
if you had to talk to yourself 3 months ago about one thing to prepare yourself for, what do you think it would be?
I would say that there's no question most shifts are very acute in terms of a lot going on. You have to be very prepared for multitasking. And you literally have to be just, confident, okay, I can do this right now, but then I have to go over here. And if you can't make that shift, it's going to be difficult.
Yeah, okay.
But other than that, you're given enough time and enough help.
It's certainly been a great experience, and seeing how in this more austere environment you have the complete care of the patient. You see them from presentation with all the manifestations of their disease, and then you look after them in the emergency department and on the ward and initiating their treatment and seeing how their treatment's progressing all the way through to whether they need to go to theatre, and then getting them home and making sure they're ready for home and follow up. So it's certainly enjoyed having that complete care of the patient with some of these novel conditions.
Our outreach department, they also do home visits throughout the province of Luang Prabang. So most of the work that they do right now is hospital follow-up. So if we have a post-surgical patient, malnourished patients, burns patients who are getting care at home, they go and just see how that is going, do home teaching, help the parents with education about doing things like dressing changes and nutritional management at home. And then they'll also do some assessment, and often when they're out there they will find people who need to be seen at the hospital, and so they'll bring patients back.
It's easy to come into another environment and think that you know the way, that your way is the right way, and that's not respecting the people that you're working with. So probably the first week I really had to stop myself from interfering and listen to the doctors and the nurses and find out why they are practicing or doing things the way they're doing, because most of the time there's a really good reason. So I think, if anything, it's taught me about restraint.
How about living in Luang Prabang? Do you think there's been a culture shock coming here from the US?
Well, I think Luang Prabang has been what I call a crossroads, in that there's so many people from so many different places that it really was a really nice mix.
It's quite an international workforce we have here, really.
So much so. I mean, meeting people from all parts of the globe. People that, I had dinner one night. There was a Russian, a Lao, a Swiss, 2 Belgians, me, and a person from France.
United
at the
Nations.
same table.
Yeah.
And I thought, where is this going to happen other than here?
Yeah.
Luang Prabang has been an amazing host city for me while I've been here, and you can look around you, there's just so much greenery, and the mountains and hills I just love how they kind of encompass the city, and the culture here is amazing. You can walk around the temples and see how they've been very meticulously taken care of, and the markets, you can find whatever you need whenever you need it. Haggling with people over prices.
It's very beautiful. I have really enjoyed. I don't normally ride a bike in Melbourne, and I had to practice on my bike before I came, and what I've most enjoyed is actually riding to the hospital and from the hospital every day. And my favourite place in Luang Prabang is Pusi Market, and that is halfway between town where I'm staying and the hospital. And most days I go to Pusi Market, and I think I'm the only Westerner there, and I buy all my vegetables and fruit.
Luang Prabang's been fantastic. I last came here nine years ago with my wife, and there's a great network of doctors and nurses and physios and other staff we've got here. So while everyone back home thinks I'm doing such a worthy cause out here, it's been great, the social side of things, to hang out. We can enjoy the great food and the lifestyle and some of the natural beauty around here as well. It's been fantastic. My family arrived at the weekend. They're having a wonderful time already, and we've seen some of that stuff in the last few days, and it's a great place to visit, it's a great place to work, and I've loved the month I've had here.
My name is Amanda Stock, and I am a volunteer from Melbourne, Australia.
Hi, my name is Sangeeta Jain, and I'm originally from Calgary, Alberta.
Hi, my name is Dr. Ed Egan. I'm originally from the UK.
Hi, I'm Pat Flannery. I am from the U.S., from beautiful Colorado.
So Eric and Christina, I'm so glad that you guys are here volunteering in the radiology department. Volunteers are really what make this place function in a lot of ways. Hi, I'm Greg Thompson. I'm the medical director at Lau Friends Hospital, and I started here as a volunteer almost 2 years ago. After falling in love with the hospital, the patients, and the medical care, I came back as a medical director.